Welcome home to USA Global TV and Radio, a place where dreams take flight, with authentic storytelling, diverse perspectives and meaningful conversations, where global stories unite and bridges are built beyond all borders. Discover world-class education, entertainment, hope and inspiration. Together, we're building bridges worldwide. Subscribe to our channel, USA Global TV. Download our app, USA Global TV. Be our guest or join our team. Visit usaglobaltv.com. Thanks to our founder and executive producer, Dr. Jacqueline Kerbeck. Music score by Yeffy Tang from Cloud Road Music. Voiceover artist Mike Porter. Creative direction by Paul Garcia. USA Global TV and Radio, your home for global connection. All rights reserved. This video and its contents are the exclusive property of USA Global TV and Radio. Unauthorized use, duplication or redistribution in any form is strictly prohibited.
Good morning, good afternoon, good evening, wherever you are in the world. Welcome to USA Global TV and Radio, where we proudly provide world-class education, entertainment, hope, and inspiration. I'm Dr. Jacqueline Kerbeck, and I am your hostess for today's show. We have a brand new show. This is the first episode, and I see there are so many of you from around the world who are here for This Is FLOXED with TALIA Smith. TALIA is a brand new team member here at USA Global TV and Radio. She has an incredible background. She worked at a prominent healthcare company. She's a master's degree. She's extremely talented, and she had a beautiful life, and that life was interrupted. I'm going to let her tell you the story, and then she's going to introduce her very special guest. Let's welcome TALIA to the show. Hello, hello.
Hi.
So nice to have you here. And by the way, so many people are here supporting you.
I know. Thank you.
Tell us about your journey when your life changed.
So in April 2021, I was disabled by a fluoroquinolone antibiotic called ciprofloxacin. It was only 3 pills. That's it. That's all it took. And within 5 months, I was on hospice at 60 pounds. I had lost over 50% of my body weight. To this day, I still need 24/7 care for my survival. I'm on palliative care, and I lost my train of thought. And it's really a miracle. It's kind of emotional to talk about this. It is a miracle that I am here today to tell my story, because I went from perfectly healthy to disabled and hospice within 5 months. To picture what 60 pounds looks like, I could have never imagined that until I went through it myself. But I am here nonetheless. I survived. And with that, I've dedicated my life to being an advocate for fluoroquinolone toxicity. So thank you for all the love. I see all the comments. I wanted my first episode of This Is FLOXED really to lay the foundation for the rest of the series by explaining what fluoroquinolone toxicity is. And I couldn't think of a better way to do that than having Dr. Stefan Pieper as my first guest. Dr. Stefan Pieper has been working in a practice for integrative medicine in Konstanz, Germany, with a focus on mitochondrial medicine, acupuncture, nutrition, and homeopathy for the last 30 years. During his time at the clinic, he worked for many years in internal medicine, anesthesia, and neonatal intensive care units. He is a paramedic and holds a British Diploma in anesthesia. He is one of the leading experts in fluoroquinolone toxicity and wrote the first book on FQAD in 2020, titled Fluoroquinolone-Associated Disability, Pathogenesis, Therapy, Diagnostic Criteria. The second revised edition will be available later this year. Dr. Stefan Pieper has treated over 2,500 patients in Germany and throughout the world. Before I jump into the questions, I just want to say to Dr. Pieper, first of all, Thank you for being my first guest. I'm so nervous. And as a member of the FLOXED community, we hold you in such high regard. And we thank you and admire you for fighting this uphill battle with us and for treating us when so many others wouldn't. So I'd just like to say thank you and bring Dr. Pieper on. Hope that was okay.
Works.
Hi, Dr. Pieper.
Hi, dear Talia. Thank you very much for this very nice introduction.
Thank you. Thank you for being here. To kick off the show, I think this is the most important question we should start with is, can you give a brief overview of what a fluoroquinolone antibiotic is and what fluoroquinolone toxicity and FQAD is? Kind of all, one thing.
Of course, yeah. Well, first of all, dear Talia, I would like to thank you for having me in your program as a first guest, which is a special honor and a special occasion, of course, for me. So I feel very honored to be here today. Thank you. Well, fluoroquinolones, they are an antibiotic group, different from others. They are the first fully synthetic antibiotic group ever. All the other former antibiotics, like penicillin, for example, came from natural sources, from natural products, but the FQs, the fluoroquinolones, were discovered by chance in the 1960s as a result of manufacturing a malaria drug called chloroquine. However, they have a number of significant side effects, as you know. These side effects arise from many different causes, some of which can result in extremely serious damage, even long-term damage. And that's why we use the term disability. That's why we call it Fluoroquinolone-Associated Disability. This is this FQAD is also recognized by the FDA, and as a first step, at least the poisoning of fluoroquinolones was introduced lately as an ICD coding through the CDC, not least thanks to your support, Talia, and your initiative. Well, FQAD is a very complex illness, I have to say. Beatrice Colomb, she's a professor in Columbia, I think. She has done a lot of research in the US, and she speaks of a syndrome, a multi-symptomatic syndrome. And this means this is a mitochondrial, neurogastrointestinal encephalomyopathy. Is very, there are lots of expressions with lots of target organs in this expression, like nervous system, gastrointestinal system, brain, muscle, and even more than that. So this is really a complex illness. Perhaps you could compare this with multiple sclerosis a little bit, which also is in fact multisystemic in its effects. Patients have pain, fatigue, neurological deficits, muscle problems, paralysis, depression, neuropathies, and much more, which can, in most cases, does develop into a manifest disability like FQAD. And there are other overlapping illnesses, of course, similar to FQAD, like long COVID or post-vax syndromes, things like that. According to serious American estimates, approximately 1.5 million patients suffer fluoroquinolone side effects every year in the US alone in the US, which makes it a total of more than 3 million victims in the last 2 decades. However, fluoroquinolones are not around since 2 decades, but they are around since the 80s, so it makes a lot more sufferers. So this is actually the introduction for the fluoroquinolone issue, Talia.
Okay. My second question, because this is something that most people aren't aware of, is how did you get into fluoroquinolone toxicity and treating FQAD patients?
Well, it was actually a mixture of a coincidence and my previous work I did, or I still do. Many years ago, a patient of mine with fatigue syndrome, with chronic fatigue syndrome, she told me in my office that she had been FLOXED. And then I followed up on this and realized that many of these biochemical changes and causes of this poisoning were very similar to the disorders, to the cellular disorders in chronic fatigue syndrome, for example, a disease that we focus on treating in our practice a lot. So I then started to look into it more closely, and more FLOXED patients came to me, and I felt the need to educate myself more in this area, as there had been hardly any instructions for dealing with FQAD in the literature, really. So this eventually led to the publication of a book and to other research projects, which I do with some colleagues in Berlin and in Switzerland, about aneurysms, about small fiber neuropathy in FLOXED patients. So it still is, and it is a very interesting field, of course. But since there are so many suffering patients, this is also a very sad field.
Yeah, I know. I can say I know that personally. My next question is, as someone that's FLOXED, and with my advocacy, you can imagine all the FLOXies that I've spoken to over the last, year and a half. When somebody first gets FLOXED, we're so scared. We have no idea what's going on with our body because it's affecting everything. It's not just one thing. You're trying to pinpoint some illness that you have, but you can't. And you have doctors that don't believe you. You're gaslit. You know the whole spiel, right? But what I find that FLOXies ask all the time first, and I mean, I asked it myself too, is how do I fix it? How do I get it out of me? With the emphasis of detoxing. And that leads many of us to go on these detox protocols that sometimes they actually work, but other times they actually make FLOXies so much worse. Mm-hmm. So I think it's very important to ask you this question is, what is your advice for a FLOXie to not do when they first get FLOXed so they don't make themselves worse?
Well, very important question, actually. And the most important guiding principle in this is probably not too much action, no actionism. Many patients, they treat themselves, which usually happens at a reasonable level. They are very cautious when they do that. But then often enough, they allow themselves to be persuaded by therapists or by other doctors who may even be well-meaning into other forms of therapy, from my point of view, often inadmissible forms of therapy, which are sometimes even counterproductive, and they can trigger relapses and flare-ups and can sometimes completely overwhelm the fragile post-FLOX organism. So this is probably the main sentence in this question: to not do too much and let the body heal itself in the first couple of weeks with not too many different lines of therapy. That is why I'm more afraid of the treatment attempts post-FLOX than of the actual event of poisoning itself. Mm-hmm. Initially, I can estimate the damage quite well, but it is almost impossible to predict what will result from this therapeutic and also diagnostic. I'm thinking of gadolinium, for example, overzealousness. That's really a big problem because the patients are also overdiagnosed, and every single step in this diagnostic picture can lead to flare-ups as well.
Yeah. Now I'm going to ask the question in reverse. So what should a FLOXY do as soon as they realize they've been poisoned? Like, where do they start? Because that's that's what they ask me a lot of times too. Like, I'm FLOXed. Where do I go from here? Can you provide any advice on that?
Well, post-FLOX, the human cell actually only needs support to heal itself. This process should be not interrupted, and the process takes time, at least a few weeks or months. And in this time, it is important to provide sufficient, for example, trace elements, divalent metals, especially magnesium and manganese, to compensate for this depletion the tissue has because of the chelation these fluoroquinolones do. Another important step is to support the mitochondrial function, of course, within the respiratory chain, to provide enough antioxidant substances to get rid of the massive flood of free radicals there is around. That would be, for example, Q10 and curcuma, so turmeric. And all other forms of therapy then depends very much on the damage mechanism. If it's either neuropathy or collagen damage or the fatigue, and usually initially the focus is on the GABA disorder with significant neuropsychiatric symptoms, where many patients can no longer think clearly and can no longer adequately assess their own situation, which in turn leads to uncontrollable consequences, including from the medical perspective. Like, I've seen patients who have spent, months or even over a year in closed psychiatric wards. So this is really a drama. This is really tragic what happens with these patients.
Yeah, I feel like when you're FLOXed, the only way I can describe it is like some other being has taken over your body, like you're possessed somehow, like it's not your body anymore, and like you're not in control at all. It's a very scary place to be. And like your first year, you're developing all these new symptoms. Like every day it's something new, and you have no idea when this cycle is going to end. When am I going to stop getting these new symptoms? It's terrifying. My next question is, this is something I feel like a lot of people that are FLOXed don't understand. So I want to bring awareness to this because it has affected me greatly, as you know. A lot of people that are FLOXed develop mast cell activation, or MCAS, and oftentimes they're usually unable to tolerate many, if any, foods or supplements. And that greatly deters us from being able to do some of the things that we need to, like, let's say CoQ10 or curcumin. Like, I can't take any of that, right? So we're very sensitive, and our body fights everything that we try to put into it. And people think, oh, that's the fluoroquinolone. They're not realizing that it's something a little different, mast cell activation syndrome. So what would be your advice for people in that category that have mast cell activation syndrome and can't do anything?
Yeah, it's a very difficult situation there, and I agree. Fluoroquinolones are enormously strong triggers for mast cells. People who have never experienced any mast cell activations pre-FLOX can develop a severe clinical picture post-FLOX. This is about 10 to 20% of the patients, including you. Another 30% maybe, or maybe even 40, they had a disposition beforehand, and then an exacerbation of this MCAS with this trigger, with this strong fluoroquinolone trigger. And unfortunately, in recent years, there are also other very strong triggers around, like COVID infection, and especially COVID vaccination can trigger the mast cell system as well. So in the last couple of years, last 5 years, there were a lot of different mast cell triggers around, which makes the picture of the MCAS very, very hard to treat, sometimes uncontrollably. It is therefore important to make a clear diagnosis of the MCAS and treat according to a structured step-by-step plan. So many patients try different remedies for a couple of days or only a week or so, and then they go to another protocol. It's sometimes very confusing, and I mean, MCAS is not such a big challenge, really, if these measures are adhered to. Like if you have a structured plan. However, it is important to treat early, usually before putting together a larger treatment program for FQAD, as the system urgently needs to be calmed down before adding other potential triggers. Like you said, Q10 and turmeric can be triggers for mast cell activation. On the other hand, they are very, very important to treat the FQAD. So if you cannot calm down the mast cell system, you will lose on treating FQAD, of course, which is a big problem sometimes.
Yeah. One of the things I say to people that reach out to me that know they have mast cell is, I always say, you have to treat the mast cell first before you try any FQAD treatments.
Mm.
And would you agree with that statement?
Yeah, absolutely. I mean, the most important preparation for dealing with FQAD is that the system is calmed down in order to introduce remedies for FQAD. And so sometimes it takes really a couple of weeks or even months to treat the mast cell activation syndrome, to then change the protocol to treat the fluoroquinolone problematic, so the disorder. So you're quite right with that, yes.
That kind of leads into my next question. You've mentioned a couple of things, but we know with this kind of treatment for fluoroquinolone toxicity, it's never a one-size-fits-all approach. Every FLOXED is different, every situation. But in general, what would be the top 3 supplements that you recommend that FLOXEDs take?
Yeah, well, of course, there are some basics which needs to be taken initially. I've already mentioned the most important ones, namely the trace elements, magnesium, manganese, and other divalent metals, and antioxidants, of course. Vitamin D is also extremely important because there's almost always an initial deficiency of vitamin D. And it is very, very important for the immune system to be on a safe, high level, the vitamin D. Cysteine is very important to treat the glutathione system. omega-3 fatty acids to treat the mitochondrial membrane, as well as phospholipids, for example, CDP, choline. So these would be that would be the basics, I would say.
And you recommend the trace minerals because that is what is being pulled out by the fluoroquinolone.
Exactly. Yeah, you're right. Mm-hmm.
Okay. Just for those watching, like
Yeah.
it's taking out and you're trying to put back in to compensate for that. Yeah.
Yes, there is a huge depletion of the system for manganese and zinc and magnesium in the first place, and but also copper or selenium. So you have to be aware that the body needs huge dosage of these trace elements to start with, to start functioning again. This is the human cell.
I have another question. It's not one that we discussed, but I'm sure you can answer. I just had it as you started talking. I actually know a lot of folks that say they have problems with magnesium. Do you know why that would be? If we need it so badly, why do we have problems taking it?
Yeah, well, magnesium salts are very different. There are salts like magnesium glycinate or malate. So these kinds of salts are common salts which can be absorbed by the body very good, but only in some compartments. So it depends actually which compartment, muscle, brain, intestinal, nervous system, will need the most magnesium. So you have to choose between different magnesium salts to deliver the magnesium in the right direction, which is sometimes a trial and error. And sometimes there are as well magnesium compounds with different salts in there, which makes things a lot easier. But you have always give it different tries and different approaches with magnesium. It's not that easy.
Yeah, I feel like that's pretty much with every treatment on this protocol. You have to try lots of different things. Even, a different brand of something may make a difference. So yeah, it's pretty much all trial and error. But
Yeah.
My next question is if you could discuss a little about the stigma around fluoroquinolone toxicity and FQAD.
Yeah, I'm thankful for this question because I would like to address that important issue. The stigmatization. This seems to be sort of, a scandal within the fluoroquinolone pharma scandal. I mean, fluoroquinolone intoxications happens every day, and it's very hard to stop them. But within this scandal, the biggest pharma scandal from my point of view, there is another scandal about the stigmatization of these victims, and the disregard, the ignorance of the system, and the medical players, of course, doctors and nurses, even downright exclusion of an entire group of patients who are treated as outcasts, more or less, by this also modern and well-meaning medical system. It's almost a modern form of leper colony in which the patients find themselves. And it's precisely this system that has created the disease and created the problem in the first place through its inhuman structures. And this system has turned healthy people into seriously ill patients, and they are no longer allowed to participate in life. They're kept in a kind of a medical ghetto, so to say. And this causes the patient's functioning social and family and professional structures to disintegrate, and these structures are extremely important, of course, as a resource for recovery and as support. And this is, for many patients, the main issue, the most important problem within their very difficult situation they're in.
Yeah, I can definitely attest to that too. I feel like, you know, you're going through this life-changing event, and then you go through all of this medical trauma that just compounds what you're going through already. And I feel like oftentimes, even when you hear from people that they have healed, they're still suffering with that trauma and almost that like PTSD from the experience that they went through. And it's, I think so many of us feel betrayed, that we were made sick by a system we trusted. And then when we needed them the most, we were, you know, tossed off to the side, and we don't know what to do. We're not doctors. And then there's no one else that can treat us. Mm-hmm. So it's a very lonely and dark place to be. And that's why we're so appreciative of doctors like you. I mean, you are like a needle in a haystack. There are not people like you that exist. So I'm just very thankful. I do want to ask this question because I feel like for myself, I try not to get emotional, but being FLOXED is an emotional experience. Through all the people that I have talked to, the longer you're sick or the more relapses you have, it's hard to imagine that you're ever going to get better, right? For me, I still have not had that breakthrough in 4 years. Still, I've never got to the place where I can say that I had some sort of refluxing or setback. I haven't even made it there yet. And there are other people that are like, oh, I was doing so well, and now I'm here back at day one. Like, am I ever going to get past this? Am I ever going to get better? So I just wanted to ask you, since you've treated so many patients over the years, and I'm sure have seen everything, can you leave our viewers with a message of hope that there is hope, that we will get better, even if it takes a long time? Like, I have to hope that, you know, for myself. So would you care to comment on that?
Of course. Yes. I mean, today I got a message from a patient of mine who was a woman of about 35 or so, with a little daughter, and she was bedridden since years now, more or less, or at least 2 years, and nothing seems to help. And today she sent me the mail, I want to tell you I'm getting better, I'm out of bed, I'm moving around, I can see my daughter, and I can do my housework and things like that. And this is a little bit like a miracle, because I actually don't know exactly why that happens, but her body was able to go through this very, very deep valley, and now she is progressing. She's better. So this is hope, and you are right. Many patients, they have lost hope, and sometimes at the very beginning of treatment, they are losing hope already, and that's why an optimistic approach is the most important single factor to recovery. So words like irreversible or treatment resistant, they don't exist in my vocabulary, really. But it must also be said that these expressions were coined in connection with FQAD many years ago. These expressions like irreversible problems and treatment resistancy and things. that was a time when the therapeutic options were far from being good, and far from being as good as they are actually now, and they were almost non-existent existent to that in that time. And these observed patients, they were actually left to their own fate. They were practically untreated. And if the body was then unable to cope with this challenge, for example, because it lacked the simplest substances for regeneration, the damage was denounced as being irreversible. But these days, however, I only see very few patients who don't make any progress. And one of these patients were this patient I just mentioned. And even she did it now, and after some years, of course. And here I probably just and often enough I didn't find the right therapeutic approach. So it's always a struggle for me too. And every case is unique, and every patient is a complex being, and with many possibilities, but also with many obstacles. For example, as you mentioned before, with PTSD, for a long time I didn't pay enough attention to this enormous effects of traumatization caused by the poisoning, and I didn't understand them properly. And in the second edition of my book, a separate chapter is dedicated to this matter. It deals with hypervigilance, with the imbalance in the autonomic nervous system, and with the promotion of vagal activities. But above all, it is important to first inform the patients about what is going on in their bodies post-trauma, post-FLOXED, at the level of the autonomic nervous system. And for example, Bessel van der Kolk, he's a doctor and a pioneer in this field, and his book, The Body Keeps the Score, opened eyes for this particular issue. So you see, there's always development, and there's currently, I feel a great momentum with many new aspects of FQAD, especially as far as the therapeutical angle is concerned, but also at the formal level, of course, with the ICD coding and more publicity, like your program here, for example. Or another example is there was only recently a 90-minute documentary about FQAD and CFS and post-vac and post-COVID on one of Germany's most important TV programs called, the film was called Chronically Ill, Chronically Ignored. So yes, Talia, there's always hope, and I try to give my optimistic best to the patients, to let them see the light at the horizon, or the silver shining, or how you call it.
The light at the end of the tunnel. There is a light, right?
At the end of the tunnel, yeah. Mm-hmm.
So I know we're getting close to end of time, and Jacqueline's gonna close us out. But I just wanted to say again, thank you, Dr. Pieper, for being here. And you truly are a gift. To you, you might feel like you're just doing your daily job, but that is not what it feels like to us that are being FLOXED. So thank you. And I don't know if you have anything else you want to add before Dr. Jacqueline comes back.
No, only that I admire your approach to this illness and to this issue, and you are really fighting, and you are doing you are doing a lot for other patients as well, and that's probably the best help you can get for yourself as well. So I think, well, that the patients they should give each other the hope they need, and the optimistic view they need.
Yeah, I agree.
Wow, what an incredible episode. Highly emotional. We have so many comments, by the way. Thank you to everyone who is reaching out. I know we have just less than a minute, but doctor, I have a question for you that people may be wondering. I know, Talia, you had a urinary tract infection, which is pretty common in people. What if, doctor, you do have something that sends you to a doctor, to an emergency room, and they want to put you on a drug that is a black box drug? I mean, there's so many. I know I have ulcerative colitis and I have to make a decision about drugs. It's like, oh, it could cause brain damage, could cause meningitis. What would you say to someone who is told, listen, this is your choice, go on this drug, or we can't help you?
Well, it's a very, very difficult situation for a patient who is in need of a treatment and who asks a doctor to do something. So, but I think the most important reaction for a patient is always to ask his own or her own gut feeling, is that something I can do with my body? And I have heard so many patients after the treatment who said, well, I knew exactly that was wrong, but I did it, and I don't know why, and I wouldn't do it again. But many of these patients have had this gut feeling, this how you call it? It's an intelligence, a natural intelligence inside, and this feeling, it is so important to hear this voice which is talking inside your brain and say, well, don't do this. Don't do this. Ask the doctor for alternatives. Fight for something other than an antibiotic. Is there a way to do that? And the internet is full of possibilities for that. So the patients, they should ask themselves and ask their inner self to whether this approach with this doctor is right or wrong.
And can I just add one thing to that too, from a patient's point of view, is exactly what Dr. Pieper said. And don't be afraid to speak up to a doctor. So many people are afraid that what the doctor says is gospel, and they just do what the doctor says. No, this is your health. This is your life. You have to be your own advocate. So I just wanted to add that on to what Dr. Pieper said. Don't be afraid, because you don't want to end up like me. So.
Absolutely, that's right. And this.
So as we close out the show, I have one final question for you, doctor. And I think a lot of people are probably wondering this, because I know I hear this myself many times with ulcerative colitis. Just go holistic. Forget about the pharmaceutical industry. Try holistic methods. Try breathing exercises. Try meditation. And all these things are great, but they actually don't take away what is the crux, the root cause of the problem. So what are your thoughts about going totally holistic for something like this?
Well, the holistic approach is, of course, very important to do, but we call ourselves, our practice in Germany, an office or practice for integrative medicine. So we try to do everything. We put everything together. We put the conventional medicine together with the holistic view, and that's probably the approach which has the biggest effect for the patient. So sometimes a patient really needs the conventional medicine for high blood pressure to drop that or whatever. But on the other hand, there is so many the body can do for itself, and we only have to help the body to heal itself. And there are, in the last couple of years, there are so many different, very, very smart approaches for this matter to self-healing. So I can't really say it often enough that the holistic view is very, very important, and is a big part which is missing in the medical system.
Thank you so much. It sounds like it could be a combination of the two.
That's right.
Dr. Pieper, there are so many comments here. We unfortunately can't go through all of them, but if people want to get in touch with you, we do have a link for your books and we do have a link for your website. What is the best way for people to contact you, and who would you like to contact you?
Well, I mean, everybody who is really in need of medical help because he's FLOXED or she is FLOXED can give me an email. So that would be the best way, actually, to email me and to write about the medical problems there are, and then we can discuss a way to treat it, or sometimes a way to help without me treating it. But I do a lot of online treatment as well. So the email or the email conversation would be the best way to reach me.
Fantastic. Thank you. And we are showing that email address, and we will put it into the comments. And also, we would just like to share the link for your books. Do you want to share anything about what you've written and who is your audience for these books?
Well, I mean, the target group for the book was actually the medical staff, the doctors, the nurses. But since I realized that most of the FQAD patients are reading this book, I have, in my second editions, I have done a little bit more, a better approach to this questions the patients have. And so there is a lot more of not so scientific comments in my second edition now.
All right, thank you very much. We are going to share on the screen now your email address. And for our audio audience only, because we do have a whole bunch of people who are listening just on an audio platform, your email address is KONTAKT@praxisdrpieper.de. Thank you so much, Doctor, for being here today. Thank you, Talia, for being here today. It's been an absolute honor. And I think it's one of the best shows we've ever had.
Oh,
yes.
I go like this.
Thank you for having me. Thank you.
Talia, if people want to get in touch with you, what's the best way and who should contact you?
I mean, anybody can contact me. It's usually people that are FLOXED, think they're FLOXED, or have family members that are FLOXED. Anybody can reach out to me. The best way is probably now my ThisIsFloxed.com website. So if you just go there, there's a way to contact me. I also have a link tree too. So either way, but this is what she should, this is my website, and there's a place to contact me there.
All right. Thank you. We also have that into the comments. So thank you, Doctor, for being here and for taking the time to share your expertise with our global audience. And thank you, Talia, for bringing the good doctor. And congratulations on your first episode.
No, it's over.
Well done.
All right. Thank you. We'll see you both again. Bye for now.
Thank you.
Bye-bye.
Bye-bye. Thank you, everyone, for watching. Please do follow Talia on Instagram as well as Facebook. We have the information there in the notes, and also we have her website there. Please do contact the doctor. His email address is there as well. And if you are so inclined, please do feel free to share this video with as many people as you possibly can. Talia's put so much work into this, so let's just give her a round of applause for her incredible interview. All right, we're going to sign off now, and we would love for you to subscribe to our channel wherever you're watching, whether it's on Amazon or Roku or Facebook or Zizzle, wherever it is, YouTube. Please do subscribe so you can see more shows like this. Again, this is the show graphic. This is FLOXED. We thank you for being here today, and we're going over to our sponsors. Bye for now.
Have you ever felt unheard? Like your words float into a void, leaving you invisible and disconnected? How about feeling judged, when assumptions overshadow your truth, leaving you misunderstood and defensive? And then there's that moment when someone offers solutions you never asked for, dismissing your feelings and leaving you more frustrated than before. It doesn't have to be this way. Dr. Jacqueline Kerbeck, the listening mentor, understands. She's here to help you reclaim your voice, build stronger connections, and create meaningful conversations that inspire understanding and mutual respect. Through her groundbreaking books, online and in-person courses, and interactive workshops, you'll learn how to navigate life's most challenging interactions. Discover the power of elevated listening and transform how you communicate. Master setting boundaries and asking permission to protect your peace. Learn to recognize and release judgment, fostering empathy and true connection. Dr. Kerbeck also offers personalized coaching, one-on-one or group sessions designed to fit your unique needs. Whether in person or virtually on StreamYard, her guidance will empower you to thrive. You don't have to struggle alone. The path to deeper connections and better relationships start here. Visit drjacqueline.com or usaglobaltv.com. Join a global community of empowered listeners and transform your life, one meaningful conversation at a time. Dr. Jacqueline Kerbeck is the listening mentor. Start your journey today.
USA Global TV and Radio proudly presents Steve Klein Art at steveklein.art.
My name is Steve Klein, born Manchester, England, 1953. My quest in my lifetime is to create artwork from my soul and the deepness within my wildest dreams and fantasies. In 2012, my heart stopped when I was given too much anesthetic for a minor knee operation, and this near-death experience took me to another multidimensional world, an out-of-body experience, and I was given the gift of being blessed by an overwhelming, burning passion to become, for the very first time in my life, an artist with an eternal, passionate desire to bring my art, which I've named multidimensional, subliminal, freeform art, to the world, as only 3% recover from what I experienced, and now in my golden years want to release my cosmic, vital energy through my art to allow people to be a part of my cosmic dance.
To learn more, email roccogoodwine@gmail.com. For VIP pricing, mention USA Global TV and Radio. 5 little-known secrets for dementia caregivers with Tracy Cram-Perkins.
Hi there, I am Tracy Cram-Perkins, the host of the Dementia Home Care Show here on USA Global TV and Radio. I am also the author of the book of the same name. And you'll see this QR code. This is for an extended version of the same talk. So if you want to see the full hour-long version, feel free to scan the code and go to that website. Stick with me. We'll talk about 5 little-known secrets to make it a little easier to do dementia caregiving. What you're seeing on the left-hand side is a healthy aged brain, age 55 and above. The one you're seeing on the right is an Alzheimer's disease brain. It is in moderate disease. It is shrinking. It has holes in it. The memories that were in those holes no longer exist. When you're learning something, let's say in kindergarten, you learn how to tie your shoelace. Well, then by the time you're in 2nd grade, your brain remembers that information from tying the shoelace and applies it so you can learn more quickly how to tie more complex knots. So the brain is hardwired to do this for us, so it helps us learn faster so it doesn't take us long to acquire knowledge. The brain is looking for the information and they pick the closest to wherever that hole is. Let's look at some tips that we can use to help do that.
These are 5 simple tools you can use as a dementia caregiver to help your loved one. The whiteboard is a useful tool in recording the day's activities and the answers to repetitive questions. The calendar clock is a very useful tool to orient your loved one on the day, the date, and the time, and remind them of upcoming appointments. The communication cards are a great tool to bridge the gap when they can no longer tell you what's wrong. And then there's the pill minder for when your loved one is still able to take pills but needs prompting. The final tool I want to share with you is the memory book. It tells your loved one's story. It's a great tool for distraction, redirection, also as a conversation starter, and telling you where they are in their story so you know how to answer their questions. Music is probably the most powerful tool in your toolbox after laughter. Music is a way to maintain connection. It sticks with your brain longer than any other thing, including reading. When you're having an issue with somebody, you can play their favorite music if you move them to another room, something that makes them happy, or you can start singing songs together from their childhood. These are some of my favorite books for caregivers. My show airs on the third Tuesday of every month, and you can view past episodes on YouTube. Thank you, everyone.
This program has been brought to you in part by Tracy Cram Perkins. Connect with her and order her book at tracycramperkins.com. For more information about Alzheimer's disease, support resources, and how you can help, contact the Alzheimer's Association at 1-800-272-3900 or visit their website at www.alz.org. They offer 24/7 helpline support and a wealth of information to assist you and your loved ones.
Ever dreamed of hosting your own TV show, sharing your story with a global audience? Now's your chance to shine. At USA Global TV and Radio, we make it easy for you to create, host, and broadcast your very own TV show. Whether you're a storyteller, entrepreneur, or industry expert, we help you bring your vision to life. With our exclusive interview, live streaming, and podcasting training, you'll gain the skills and confidence to captivate your audience. Our global platform ensures your voice is heard worldwide. Join our community of creators who are already making an impact, one show at a time. Step into the spotlight. Host your own TV show on USA Global TV and Radio. Book your discovery call today at usaglobaltv.com. Copyright 2025 USA Global TV and Radio. All rights reserved. Terms and conditions apply. To learn more, visit usaglobaltv.com. Thank you, viewers and listeners of USA Global TV and Radio, for joining us today. We're honored to have your time and attention as part of our global community. At USA Global TV and Radio, we believe in the power of authentic conversations, meaningful connections, and creating a world of possibilities together. Want to be part of something bigger? Join our team of elevated listeners at usaglobaltv.com, a space where your voice matters and your ability to listen transforms relationships. Stay connected with us across all our platforms for thought-provoking discussions, expert insights, and empowering stories. Subscribe to our channels at youtube.com/c/USAGlobalTV. Follow us on social media and explore the endless opportunities we're creating for growth, learning, and inspiration. Together, we're not just broadcasting, we're building bridges and changing lives one conversation at a time. For inquiries, contact us at info@usaglobaltv.com. Music by Johnny Dyes. Produced by Executive Producer and Director Dr. Jacqueline Kerbeck. Voiceover by Mike Porter. Creative Direction by Paul Garcia. All rights reserved. Copyright 2025. Visit usaglobaltv.com to view our full terms and conditions.